So before I move on to the water-soluble vitamins, let me just say I think that in the discussion with vitamin D, talking about it actually increasing the risk of osteoporosis when you have too much of it, it's not just the calcium, but it's also the parathyroid hormones that causes the osteoclast and the osteoblast to break down the bone. So I just want you to remember that we will discuss that in greater detail in LBN 121 when we discuss disorders of the bone tissue. Let's move on to the water-soluble vitamins. Our vitamins that are water-soluble include our vitamin B complex. Now this is B1, 2, 3, 5, 6, 7, 9, and 12. Where are the ones in between? Well, what we've discovered over the years is that 4, 8, 11, 10, not really truly vitamins. And so these are the ones that we recognize. You will also see vitamin C. We'll talk about these, but not all of them in great detail. So we know the characteristics of the water-soluble vitamins is that they dissolve in water, and excessive amounts of them are excreted in the urine because they're not stored in the body. Toxic reactions can occur, but they are rare. The most common time we'll see a reaction is with niacin. And we'll talk about why that is in just a few minutes. But the water-soluble vitamins act as coenzymes or oxidation reduction agents. With B1, our thiamine, we find it in food sources such as enriched whole grain breads and cereals, liver, beans, yeast. Now, in these discussions, when we're talking about yeast, there are different kinds of yeast. There's brewer's yeast, which is used to brew beers and other fermented drinks. There's baker's yeast, and there's nutritional yeast. And technically, they're made from the same species. They're fungus, but the baker's yeast is purchased, it's alive, and it's used to leaven bread. So you would not eat that straight. You would not sprinkle that over your ice cream. However, nutritional yeast is a deactivated yeast, and it is specifically used to thicken sauces, to mimic the flavor of some certain cheeses. It is made to be eaten straight or directly. You can also include it in recipes. So don't confuse those yeast. You don't want to eat baker's yeast without it being involved in some sort of baking process and activated and then used up to create the rising that we know in yeast, right? So let's move on. Deficiencies of thiamine B1 include beriberi. This it causes brain lesions, polyneuropathy of the peripheral nerves, some serious effusions, and cardiac anatomic changes. We'll also see Wernicke's encephalopathy. This is known as cerebral beriberi. You may remember from nutrition, or if you're taking it in this semester, you'll learn more about beriberi, wet beriberi, dry beriberi, and how that is treated. We treat the deficiency with the thiamine, right? So causes of the deficiency can include a poor diet, an extended fever, hyperthyroidism, liver disease, alcoholism, malabsorption, which can be from any other disease or condition that causes a lack of the ability to absorb in the gut, pregnancy or breastfeeding. Our B1 functions are that it's essential for carbohydrate metabolism and is involved in many of our metabolic pathways, including the Krebs cycle. Thiamine maintains the integrity of our peripheral nervous system, our cardiovascular system, and our GI tract. We are seeing it as an indication to give thiamine when we have a thiamine deficiency, obviously, in the presence of beriberi, Wernicke's encephalopathy, peripheral neuritis that's associated with a condition called pellagra, and neuritis of pregnancy. We will see it sometimes given in other metabolic disorders when there is a malabsorption syndrome, in the management of poor appetite, ulcerative colitis, chronic diarrhea. There is a thing called cerebellar syndrome that also is cerebellar ataxia. And interestingly, some use it as an oral insect repellent. Now, vitamin B2, that's our riboflavin. Our food sources for this are green leafy veggies, our eggs, dairy products, nuts and legumes, meats, liver, our yeast again, enriched whole grain products. In deficiency, we see it often with alcoholism being the major cause of both thiamine and riboflavin, intestinal malabsorption, sometimes with long-term infections, liver disease, malignancies, and probenecid therapy. This is a medication that is used in the treatment of gout. So we have to be careful that these patients that are using that medication will know that they might need a riboflavin supplement. However, they're likely to get most of it from their diet. With a deficiency, what you'll see is cutaneous changes of all the cutaneous tissues. So you may see a seborrheic dermatitis, a keratitis. In the oral tissues, this is going to look like a cheilosis, where they'll complain that their lips feel chapped all the time, or they get little fissures at the side, particularly of the lips, at the creases. The problem is that those creases then also sometimes get infected with yeast, and so you have this problem that causes the pain. And it's basically thrush there at the corners of their mouth. Indications for riboflavin include dietary supplement, treatment of the deficiency if they have one. We use it in microcytic anemia, acne treatment, migraine headaches. There are many other uses. There never really has been any reported adverse effects, but large doses of this supplement will discolor the urine to a yellow-orange color, so patients need to be aware of that. Now, niacin, our B3, is also synthesized from tryptophan, which is an essential amino acid that's obtained from protein digestion. But food sources include beans, turkey, liver, again, our yeast, tuna, enriched whole grain breads, its cereals, and wheat germ. Remember, our wheat germ has to stay in the refrigerator if it's going to hold its effectiveness. Deficiency of niacin can occur. Once digested, the niacin is converted to nicotinamide. Then that's converted to two coenzymes. Those are required for glycogenolysis and the tissue respiration, as well as lipid, protein, and purine metabolism. So what are the indications for niacin to be given? Well, at the treatment and prevention and treatment of pellagra. We talked about B1 being a therapy for pellagra, but that is for the peripheral neuropathy. With pellagra, remember we have the 4 Ds: dermatitis, diarrhea, dementia, and ultimately death if not reversed. We do not see a lot of that in the United States, but we will see it occasionally. We see it more frequently in Africa and some parts of Asia as a result of not having enough niacin because they are dealing with maybe basically a corn-based diet. We'll see it being given for alcoholism, eating disorders, liver disease, certain cancers, GI disease or malabsorption syndromes, and then with some medications. Niacin has been given as an antihyperlipemic for over 50 years. As an antihyperlipemic, it lowers the serum cholesterol and triglyceride levels by reducing the very low density lipoprotein synthesis. The dose, however, required for this effect are higher than those required for nutritional and the metabolic effects. So its use is somewhat limited. The most common side effect from these large doses of the niacin is called the niacin flush, and that's a dilation of the capillaries of the skin with this perceptible tingling. It can actually be painful to the patient. So with the well-tolerated, effective medications that we have, you don't see the high doses of niacin being given as they were in the past. Large doses of niacin can also cause sometimes we will use these higher doses for the treatment of acne or for the treatment of pellagra prevention, but this flushing of the skin, rash, GI upset, distress, and it can cause muscle weakness as well as liver injury. Rarely it can cause vision disturbances, but that can occur. Pyridoxine, this is our B6. Our food sources for that are whole grains, wheat germ, yeast again, fish, organ meats, poultry, eggs, nuts and legumes, vegetables, and bananas. Our pyridoxine is composed of 3 compounds: the pyridoxine, the pyridoxal, and the pyridoxamin. It functions for is necessary for many of our metabolic functions, including protein, lipid, and carbohydrate utilization, and it's needed for the conversion of tryptophan to niacin. It's necessary for the integrity of our peripheral nerves, our skin, our mucous membranes, as well as the hematopoietic system. Signs and symptoms of a pyridoxine deficiency include sideroblastic anemia, neurologic disturbances, seborrheic dermatitis, chelosis again, like we had with our riboflavin deficiency, glossitis, stomatitis, can have epileptiform convulsions, and a hypochromic microcytic anemia included, as well as our sideroblastic anemia. Causes of deficiency include our inadequate intake, poor absorption, uremia, alcoholism, cirrhosis, hyperthyroidism, malabsorption, heart failure. Can also have deficiency as a relation to medication interactions like isoniazid, hydralazine, and some of the other medications that may be ordered. Our deficiency, when we have this, we may use this because of an actual B6 or pyridoxine deficiency, but it's also sometimes given for seizures that are unresponsive to the usual therapy. We will see it used for morning sickness during pregnancy and various metabolic disorders that might respond to this therapy because it is so involved with our other processes of protein, lipid, and carbohydrate utilization. Large doses with this, you will see flushing, headaches, lethargy, neurotoxicity, and when we give it as an injection, you will see pain at the injection site. Now our cobalamin, this is our B12. B12 is primarily found in our animal products: liver, kidney, fish, shellfish, poultry, milk, eggs, blue cheese. Fortified cereals, however, can have it, as well as minimal amounts in plants. We'll find it in fermented soybean, that's called tempeh. We also have high levels of it in black trumpet, golden chanterelle, and shiitake mushrooms. Our dried green lawver and our dried purple lawver, or you'll also hear that referred to as nori. That is a high content of B12. That's what we wrap our rolls in, right? Our seaweed rolls from the sushi bar. What does it do? Well, cobalamin functions as 2 different coenzymes, and they're required for many of our metabolic pathways: fat and carbohydrate metabolism, protein synthesis, growth and cell replication, hematopoiesis, nucleoprotein and myelin synthesis. When we have a deficiency, we can have what's called pernicious anemia. We may have neurologic damage or a megablastic anemia. These are often caused by malabsorption. Poor dietary intake in vegans and vegetarians can also be a problem. When we give it in its synthetic form, it's called cyanocobalamin. This is our B12 synthetic. Oral absorption requires that we have the presence of the thing called the intrinsic factor. The intrinsic factor is a glycoprotein secreted from the gastric parietal cells. When we lack intrinsic factor, either because of a change in the GI tract, maybe there has been some type of a surgical intervention, aging also can cause a decrease in the activity of the parietal cells, and therefore pernicious anemia is a risk as you age. We give the medication ideally in the IM route as opposed to an oral route because you have to have the intrinsic factor in order for it to be absorbed. Toxic levels are actually quite rare. When we do have it, we can have itching, some transitory diarrhea, and fever. Vitamin C, our food sources for this are our citrus fruits and juices: strawberries, tomatoes, potatoes, broccoli, spinach, Brussels sprouts, cabbage, green peppers, liver. We can also synthesize some of this. It functions in the oxidation reduction reactions, metabolic activities, collagen synthesis, maintenance of connective tissues, tissue repair, bone, teeth, capillaries, erythropoiesis, and folic acid metabolisms. It also helps with iron absorption. We give it for zinc, with zinc for wounds. And you notice we can only record for 15 minutes at a time. So I'm going to flip to this next slide. Be sure you read these slides. Be sure that you understand what's on them. Let's take another break. We've got one more section to go.